Welcome to the Part A Benefit Periods edition of Medicare in Minutes, a micro-learning series designed to help you understand the ins and outs of Medicare. A benefit period is how Medicare measures the use of inpatient treatment in a hospital and or services in a skilled nursing facility under their Part A coverage. Benefit periods determine the cost-sharing requirements for beneficiaries while seeking treatments from either of these two types of facilities. A benefit period begins the day an individual is admitted into either a hospital or a skilled nursing facility, often referred to as a SNF. This period ends when the individual has not received inpatient hospital or SNF care for 60 days in a row. The benefit period is not tied to the calendar year. Should beneficiaries be admitted to a hospital or SNF after one benefit period has ended, a new benefit period will begin. There is no limit to the number of benefit periods an individual may experience, nor is there a cap on the duration a period can last. While Medicare beneficiaries have coverage in both an inpatient hospital setting as well as a skilled nursing facility, the individual time frames and cost share responsibilities are much different. When beneficiaries experience an inpatient hospital stay, they must meet their Part A deductible at the beginning of each benefit period, and upon meeting this deductible, Medicare covers the full cost of 60 days of treatment. Beneficiaries are responsible for a daily coinsurance for days 61 through 90 they spend admitted within one benefit period, and may be responsible for all costs following 90 days. Medicare provides beneficiaries 60 lifetime reserve days, which may extend Part A's coverage within benefit periods after the individual has exhausted their 90-day coverage allowance for that benefit period. Beneficiaries have twice the coinsurance obligation during reserve days as they do on days 61 through 90. Reserve days may be applied to a benefit period in any quantity and may be applied to multiple benefit periods. But once an individual's reserve days have run out, they do not replenish. Individuals seeking services within a skilled nursing facility must have been admitted at a hospital for a minimum of 3 days prior to being moved in order for Medicare to cover the SNF. A doctor must certify the individual's need for daily skilled care, which must help improve or maintain their current condition or prevent or delay it from getting worse. Let's take a look at an example. Garrison falls after experiencing heart failure and spends 90 days in the hospital. He is then transferred to a rehabilitation center, which is considered a SNF, for 75 days before being discharged. Unfortunately, 1 week later, Garrison is brought back to the hospital and admitted again, but this time for only 5 days. This brings his total hospital days to 95 because he was admitted to the hospital within that same 60-day benefit period. Because the benefit period only covers 90 days, and Garrison was admitted to the hospital for the second time within 60 days of being discharged, Garrison will have to use some of his lifetime reserve days to cover the additional days he had added within the same benefit period. Should Garrison need to seek treatment from these facilities after more than 60 days, he will start a new benefit period and be subject to another Part A deductible. Medicare beneficiaries may experience confusion regarding the 3 unique 60-day timeframes associated with benefit periods, so let's break these down one more time. The first 60-day time frame applies to covered days in a benefit period. This is the maximum number of days Medicare Part A will cover 100% of inpatient hospital or skilled nursing facility coverage once a beneficiary satisfies their deductible. The second 60-day increment pertains to reserve days, on which beneficiaries will shoulder a larger portion of costs following 90 days of treatment within a benefit period. Individuals have a lifetime limit of 60 reserve days. The third and final 60 days is about the time that must elapse in order for a beneficiary to experience a new benefit period and Part A deductible. Individuals who experience 60 consecutive days without inpatient hospital or SNF treatment following their services will begin a new benefit period the next time they seek these types of care. While Medicare benefit periods can be nerve-wracking, you can take steps to prevent some of the stress associated with them when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.